If you or someone you love has just been diagnosed with cancer, whether you're the patient, a spouse, a parent, or a child, everything can feel uncertain. And uncertainty is often the hardest part of the cancer journey. But there's a process to really reduce this uncertainty, and it begins with understanding the steps in the cancer journey. Steps that can be easily understood. And once you understand these steps, this cancer journey can be a lot more manageable. I'm Dr. Adam Kase, and I'm a medical oncologist, and I take care of patients with cancer nearly every day. And a big part of what I do is helping patients walk through their cancer journey step by step. In this video, my goal is simple. Reduce that uncertainty that you have by helping you understand the 5 steps that guide almost every cancer journey. This is the information that I wish I had time to share with every patient at the very start of their diagnosis, but simply can't in a single visit. But that changes today. This is the information I want to share that is beyond the clinic. This channel exists for the moments between the appointments, when you have questions and need real answers. That is my why I started Arcana Oncology, to provide patient-centered, specialized knowledge and hope so people just like you can move forward with clarity and confidence. So let's jump right in. Step 1, diagnosis. What is the cancer? The answer to that question comes from a biopsy, or sometimes a surgical procedure where we take a small piece of the tumor. And get this, one of the most important people at this point in your journey is someone you will likely never meet: the pathologist. They are the physician who takes the tissue, looks under the microscope, and gives your tumor a name, like breast cancer, prostate cancer, lung cancer. Sometimes this process is very straightforward, but other times it can take more time, more testing, and more analysis is performed by the pathologist. But this single step, the diagnosis, guides everything that comes next, which is why it is important to get the diagnosis correct from the very beginning. However, it doesn't give us the full picture. So the next question then becomes, what else do we need to know? And that brings us to step 2. Step 2 is testing. What do we need to complete the whole picture? This is the part that can feel like it's slow, sometimes like it's moving at a snail's pace. And that can be so frustrating. That being said, a thorough workup is critical, because we're not just trying to act quickly, we're trying to act correctly. So we can come up with the stage of your cancer and build the correct treatment plan. Now, the steps I'm going to walk you through today are focused on solid tumors or solid cancers. Cancers like prostate, kidney, bladder, lung, breast cancer, colon cancer, and many others. If you or someone you love has a blood cancer, like leukemia or lymphoma, some of these steps will still apply, but the path can look a little bit different. For now, let's focus on solid tumors. The workup for your cancer can include several things. Imaging, like CAT scans, MRIs, PET scans. This helps us determine where the cancer is located. In some cases, additional procedures are needed, like endoscopies, where we use a camera to look inside different organs to help gain more information. For example, a scope in the lungs or bladder, and it really depends on the cancer. Blood work is also important. It helps us understand how the organs are functioning and sometimes helps detect tumor markers. For example, tumor markers can be used in breast cancer, prostate cancer, colon cancer, and others. But there's another part of testing that is just important as these, and it helps us to understand the biology of the cancer. We start asking questions like, what is driving this cancer? Are there specific mutations? Are there targeted treatments available? And that last question is very important. I'm going to come back to that shortly. But this next part is wild. We now have the technology and tests to look inside the cancer and understand what's driving it. For my car enthusiasts out there, it's like looking under the hood to see what kind of engine it has. And this is accomplished by genetic testing. Testing to discover mutations, which are errors or mistakes in the DNA that can either increase your risk of cancer or drive the cancer's growth. These genetic changes can come from two places. First, they can be inherited, passed down from mom or dad. These are called germline mutations, and they can increase your risk of developing cancer. Second, genetic changes can develop within the cancer itself and are called somatic mutations. Somatic mutations happen over time and sometimes develop due to environmental exposures, and other times for reasons we just don't fully understand yet. Now, you might be thinking, I don't think I've had genetic testing, and that's okay because not every patient needs it. It really depends on the type of cancer, the stage, the clinical situation. This can be a question that you can ask your doctor. But one of the main reasons that we get genetic testing, particularly in more advanced cancers, is to answer a critical question. Are there targeted treatments available? Because today we have treatments that are guided by precision medicine, meaning treatment that is tailored specifically to your cancer based on its biology. As you can probably see, step 2 of this cancer journey requires a lot of testing and can take time, but it's critical that we have the full picture before we move on to the next step, which is step 3, staging. Where is the cancer? Staging tells us where the cancer is and whether it has spread to other parts of the body. Most cancers are staged from 1 to 4, with a few exceptions like testicular cancer, where stage 3 might be the highest stage. But staging does more than just tell us where the cancer is. It helps us guide what type of treatment is needed to try and cure the cancer or provide the best possible control. Now, each cancer has its own specific rules to staging, but in general, staging is based on the size of tumor, how deeply it invades into the organ, and whether it is spread to other sites. Stage 1 is usually localized, meaning it's confined to where the cancer started. As the stage increases, the cancer may be larger, more invasive, meaning penetrating more tissue layers, or spread beyond the original site. Stages 3 and 4 represent more advanced disease, either due to local extension or spread. For example, if prostate cancer spreads to the liver, that doesn't mean that you have liver cancer. It means you have prostate cancer that has spread or metastasized to the liver. That would be stage 4 prostate cancer. As the staging goes higher, the cancer can become harder to treat and may require combinations of treatments. I want to make something very clear. Stage 4 cancer does not automatically mean that there are no good treatment options. In most cases, advanced cancers can still be treated and treated well, sometimes controlled for long periods of time, and in certain situations, even cured. It all depends on the type of cancer, where it is, and what treatments are available. And we're going to come back to this later in the video when we talk about treatment. So let's zoom out for a second. So far, we've answered 3 questions. Step 1, what type of cancer is it? Step 2, what testing do we need to complete the full picture? And step 3, where is it? And all of that brings us to step 4. And this step might be the most important part of the entire process. Step 4 is patient goals. What matters most to you? Because treatment decisions are not just about the cancer, they're also about your life, your goals, what matters most to you. You know, we start thinking about your overall health, other medical conditions, medications, and what treatments you can tolerate. But just as important are your goals. What are you hoping to achieve with treatment? Is the goal to cure the cancer, control it as long as possible, minimize side effects, maintain quality of life? Now, I know what you're thinking. Well, I want all of those things. And honestly, that makes complete sense. Most patients do. But the reality is, cancer doesn't always give us every option at once. Sometimes the type of cancer, or the stage, or the biology means that certain goals have to take priority over others. And in those situations, your team's job is to make sure that your goals that matter most to you are the ones that drive the plan. And here is something I want every patient to understand. Everyone tolerates treatment differently, and every cancer responds differently, even if it's the same type. What works well for one person, your neighbor, family member, may work differently for you and may need to be adjusted in a way for you. Side effects may come up that we didn't expect. The cancer may respond in a way that makes us need to pivot. And that is completely normal. Your goals, they're not just a checkbox. They're really a living conversation that can change throughout the cancer journey. And the role of your doctor is not just to hand you a treatment plan and then walk away. It's to watch how you respond, listen to what you're experiencing, and then make adjustments so that your goals remain the top priority every step of the way. Let me give you an example. Let's say someone is a professional guitar player. Their hands, their sensation, their dexterity, that means everything to them. Now, some treatments can cause neuropathy, tingling in the hands and the feet. And I've had patients say, I'll do anything except risk my ability to do X. In this situation, play guitar. So with that in mind, we build a treatment plan that respects that. We might adjust the medication, adjust the dosing, monitor closely, and taking treatment holidays if needed. Because that's what matters most to them. And what matters most to them, or you, matters most to us. The best treatment plan is not the one that's just medically correct. It's also personally right for you. It's where what we know medically and what matters most to you come together. That's the perfect plan. And the role of your treatment team is not just to recommend the treatment, it's to guide you through the options so that you can make the best decision together. Now, you don't have to have all the answers right now, but you should feel comfortable asking, what are my options? What are the risks? What are the goals of treatment? And what do we do if things need to change, if we need to pivot? That's when we move on to the final step. Step 5, treatment strategy. What is the plan? This is the moment you have been waiting for from the very diagnosis. Okay, I've got cancer. What are we going to do about it? This is where we bring everything together and build a plan, but not just any plan, the right plan for you. Treatment may include surgery with a surgeon, radiation therapy with a radiation oncologist, or systemic treatments, meaning they go through your body, and that's given with a medical oncologist, like myself. Some examples of those systemic therapies are chemotherapy, immunotherapy, hormone therapy, or targeted therapies. These can go in through the vein. They can go by mouth, oral medications. Your doctor might also mention clinical trials. A clinical trial is not a last resort. It's really an opportunity to get access to the most cutting-edge treatments available, often before they are widely available to the public. Nearly all treatments that we have today that are considered standard of care, the ones that are saving countless lives, started as a clinical trial. So when your doctor mentions a trial, that's not a sign that they've run out of options. That might actually be the best treatment option on the table at the time. And it's always worth asking, is there a clinical trial right for me? Now, the exact treatment plan for you depends on everything that we've talked about so far. Because treatments, they're not one size fits all. And one of the most important things we define at this point is the goal of treatment. Is the goal to cure the cancer, control it as long as possible, or maybe to relieve symptoms and improve quality of life? And that goal guides every decision that we make. Now let's come back to something that I mentioned earlier. Even late-stage cancers can be controlled long-term or even cured. And this is how that happens. It starts with building a plan that is individualized and based on your specific cancer, because not all advanced cancers behave the same. And I've seen this countless times where treatments like immunotherapy have led to long-term control and even cures in metastatic stage 4 cancers like kidney cancer, bladder cancer, melanoma, and many others. We may also be able to reach this goal of long-term control or even cure by combining treatments like systemic therapy with surgery or radiation. There are more possibilities today than ever before. We are constantly advancing with new therapies, new technologies, and more personalized approaches. But you have to remember that you are not just receiving treatment, you're part of that decision-making process. You should understand why we're recommending a treatment, what the goal is, and what to expect. So when we take a step back and look at the cancer journey, it's not just one overwhelming moment. It's a series of steps that together answer one simple question: what do we do next? And once you understand those steps, this becomes much less overwhelming. And that's how we move from uncertainty to understanding, to seeing a clear path forward. And if you're watching this video right now, you're already making the right steps towards a better understanding of your cancer journey. If this video helped bring you some clarity, consider hitting the like button and subscribing so others navigating this cancer journey can also find it too. And share in the comments. Let me know where you are in your cancer journey and what part of this video was most helpful. Stay with me for the next video where we'll break down step 1 in even more detail and better understand how cancer develops in the first place. Until next time, choose hope.